Good morning, everyone, and thank you to each and every one of you for being here with us today. We are pleased to be able to welcome those of you that have been with us for a long time now, as well as those who are new to the department. In today's gathering, we would like to focus on all our nurses who have joined us since the before. You have all been chosen to be part of this team due to a mutual passion for our patient. Your passions help us all to unite, and the energy we create in what allows us to achieve our individual as well as a group goals. Today, we will be learning about a day in the life of a person with diabetes. I hope this will help you grow to be more productive and smart in taking care of your patients with diabetes. Thank you.
Let us put ourselves in the presence of the Lord. Dear Father, we offer everything and thank you for everyone gathering here today to walk with you. May we ask you for your blessing and guidance so that the activities set for this undertaking be successful. We ask you to open our eyes to see the wonderful things from this activity. We ask that you to open our ears so that we may retain the invaluable knowledge. Open our minds for us to think wisely. Put us with understanding, cooperation, and peace in fulfilling our responsibilities. Open our hearts so that we may receive your everlasting love, and open our spirit so that we may know that you are with us all throughout the day. We ask all this in the name of Jesus Christ. Amen.
Thank you, Flor. Hello and welcome. I'm one of your hosts and speaker, Sharina. Thank you for taking the time to join us today as we talk about a day in the life of a person with diabetes. You live with the importance of diagnosing diabetes when treatment is easier and outcome is better. And to make sure we're helping you as best as we can on diabetes, we have a chat box to source your questions. Feel free to drop questions on the topic or share your struggles and experiences. We'll answer your questions by the end of our presentation. Also, don't worry about making notes immediately since we'll send the session's recording your way before the day ends. So without further ado, let me introduce you to the pros who'll talk about diabetes. With our speaker, Nurse Flora Jen, Nurse Charina, Nurse Sir Jane, and Nurse Frida. These guests will train you about diabetes. First of all, let's start with issues in diabetes care and management, depression and diabetes associated with cardiovascular risk in DM. Thank you.
Hi, good evening, everyone. My name is Fredaling Mendez, and I'm going to present about the issues in diabetes care and management, depression and diabetes, and cardiovascular risk in diabetes mellitus. So, diabetes is a chronic disease that occurs either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Insulin is a hormone made by the beta cells in the pancreas, which helps glucose from the food to get into the cells to be used for energy. So diabetes affects how the body uses blood sugar. This means that glucose remains in the blood. There are three types of diabetes. Type 1 diabetes is thought to be caused by an autoimmune reaction. The body attacks itself by mistake, and this reaction stops your body from making insulin. It is usually diagnosed in children, teens, and young adults. Type 2 diabetes, this one, the body doesn't use insulin well and can't keep blood sugar at normal levels. Type 2 is the most common diagnosis and is followed by type 1. Gestational diabetes occurs during pregnancy and is usually temporary. And in addition, pre-diabetes is another important diagnosis that indicates an elevated risk of developing diabetes. So when there isn't enough insulin, too much blood sugar in your bloodstream will remain. And over time, that can cause serious health problems such as heart disease, chronic kidney disease. So in chronic kidney disease, each kidney is made up of millions of tiny filters called nephrons. And over time, when high blood sugar from diabetes occur, this can damage the blood vessels in the kidneys and as well as the nephrons. So they don't work well as well as they should. Many people with diabetes also develop high blood pressure, which can damage kidneys too. So keep your blood sugar levels in your target range as much as possible. So with nerve damage, high blood sugar can also cause diabetic nephropathy. High blood sugar damage your nerves, and these nerves may stop sending messages to different parts of your body. Nerve damage can cause health problems, ranging from mild numbness to pain that makes it hard to do normal activities. Nerve damage, along with poor blood flow, puts you at risk of developing a foot ulcer. It is a sore or wound that could get infected and not heal well. If an infection doesn't get better with treatment, your toe, foot, or part of your leg may need to be amputated or removed by surgery to prevent the infection from spreading into your body. So if you're diabetic, check your feet every day so that you can catch problems early and get them treated right away. And going to all doctor's appointments are for preventing foot problems also. If your sugar level is high in your blood, it's high in your saliva too. So bacteria in plaque use sugar as food. Some of these bacteria can cause tooth decay, cavities, and gum disease. So if the tooth is not treated, it can also lead to tooth loss. And regular dental visits are important to prevent these problems. And diabetes can also damage your eyes over time and can cause vision loss, even blindness. So diabetic nephropathy is caused when high blood sugar damages blood vessels in the retina. These symptoms may not be noticed in the early stage, so it's very important to get an eye exam at least once a year to catch any problems early when treatment is most effective. And diabetes can also cause nerve damage in your ears. Over time, high blood sugar levels can damage small blood vessels and nerves in the inner ear. Low blood sugar over time can damage how the nerve signals travel from the inner ear to your brain. This can lead to hearing loss, and keep your blood sugar as close as to your target levels as possible and get hearing checked every year. Diabetes complications often share the same risk factors, and one complication can make other complications worse. Participation in decision-making plays a key role in patient understanding of diabetes self-management and subsequent self-care practices. So for example, many people with diabetes also have high blood pressure, which in turn worsens eye and kidney diseases. Diabetes tends to lower HDL or the good cholesterol and raise triglycerides, and LDL, the bad cholesterol. These changes can increase the risk for heart disease and stroke. The current challenges in diabetes management include optimizing the use of currently available therapies to ensure adequate glycemic, blood pressure, and lipid control, and to reduce its complications. And educating patients on diabetes self-management, improving patient adherence to lifestyle and pharmacologic interventions, and reducing barriers to the early use of insulin, and improving the delivery of healthcare to people with chronic conditions. So depression and diabetes. Living with diabetes can be burdensome and can provoke anxiety, with the constant demands taking a toll on your mental health. Although a period of grieving is normal with the diagnosis of any chronic diseases, prolonged sadness may be a sign of depression. Depression is a medical illness that causes feelings of sadness and often a loss of interest in activities you used to enjoy. So, if you are feeling depressed, normally you are feeling sad or like you have a feeling of hopelessness, and it is often undiagnosed and untreated that can lead to harmful life decisions. And this can include unhealthy eating, less exercise, smoking, and weight gain. All of these are risk factors for diabetes. And depression can make it hard to do tasks, communicate, and think clearly, and can get in the way of how well one functions at work, and home, including taking care of diabetes. When you cannot manage your diabetes well, your risk goes up for diabetes complications like heart diseases and nerve damage. Depression is twice as common in people with diabetes as in the general population, and it is also associated with poorer blood sugar management, health complications, and decreased quality of life. Individuals with diabetes should be regularly screened by their healthcare provider for psychological distress and psychiatric disorders. Next is cardiovascular risk in diabetes mellitus. Heart disease is very common and serious. It is a leading cause of death for both men and women in the United States. So if you have diabetes, you are twice more likely to have heart disease or a stroke than someone who does not have diabetes at a younger age. The longer you have diabetes, the more likely the more likely you are to have heart diseases. According to the Centers of Disease Control and Prevention, over time, high blood sugar can damage blood vessels and the nerves that control your heart. People with diabetes are also more likely to have other conditions that raise the risk for heart disease. High blood pressure increases the force of blood through your arteries and can damage artery walls. High triglyceride, a type of fat in your blood, high triglycerides, a type of fat in your blood, and a low HDL, a good cholesterol, high LDL cholesterol, so to contribute to hardening of the arteries. And none of these conditions has symptoms. You have to have a doctor's appointment, or you have to go to your doctor for a checkup, check your blood pressure, and do a simple blood test to see if your LDL, HDL, and triglyceride levels are high. That's all, and have a good evening.
For diabetes self-care management and training, self-care in diabetes has been defined as an evolutionary process of development of knowledge of or awareness by learning to survive with the complex nature of the diabetes in social context. Because the vast majority of day-to-day care in diabetes is handled by patient and or families. One of the biggest challenges for healthcare providers today is addressing the continued need and demands of individuals with chronic illness like diabetes. Okay. For the management and self-care, there are seven key areas. of self-care behavior help manage diabetes. Number one is the healthy eating, physical activity, monitoring, taking medications, problem solving, and reducing the risk. Healthy coping. Diabetes self-management training. An essential part of diabetes care services provide people with diabetes with the knowledge, skills, and ability to perform diabetes self-care tasks. The process involves informed decision-making, problem-solving, and collaboration with the healthcare team to improve clinical outcomes, health status, and the quality of life for people with diabetes. The diabetes educator works closely with the patient to provide DSMT service according to Indian Health Service 2011. So, as you can see here, example for the self-care management education and support for the healthy coping. Okay, for the diabetes nursing education in the Philippines, US, and UK. First, in the Philippines, and the ADNEP, Association of Diabetes Nurse Educators of the Philippines. First is a subspecialty organization of the Philippine Nurses Association, or the PNA, that provides continuing professional education as duly recognized by the Professional Regulation Commission Board of Nursing, or the PRC-BON. Provides quality diabetes care through education, training, and research by conducting regular postgraduate. In United States, the American Diabetes Association is accredited as a provider of continuing nursing education by the American Nurses Credentialing Center, or COA. That was according to American Diabetes Society in 2018. So certification and license. Certified Diabetes Educator, governed by the National Certification Board of Diabetes Educators, experienced healthcare professionals who met the discipline, professional practice, and continuing education requirements can earn this certification. Board Certified Advanced Diabetes Management, a registered nurse with a master's degree and at least 500 hours of clinical practice over the last 48 months may sit for board certification in advanced diabetes management. So under the United Kingdom, diabetes specialist nurse, or DSN, are well documented. It was according to DOH 2012, Diabetes UK 2018. They have an integral role providing care and support for people living with diabetes and their families over the life course of the condition, with ever advancing treatment regimens for diabetes. The role and responsibilities of DSN have continued to evolve in order to reduce burden on the health service and provide the best possible care for individuals. This evolution has occurred in a fragmented manner across the UK. So for the new trends in diabetes care management, stem cell technology and novel therapeutic approach. Stem cell are unspecialized cell of the human body and can differentiate into any cell, organism, and have the ability of self-care in one. Okay, that's all for me. Thank you.
Ulit ka. Sabihin mong that's the end of my...
Ako.
Sabihin mo nga, that's the end of my... Balik ko nga.
Sige, balik mo. Tapos edit mo na lang.
Tapos, okay, that's the end. Sige.
Okay, that's the end of my health teaching. And I'm gonna answer for the question. I'm gonna answer the question later.
Hi everyone, I'm going to discuss about the new trends in diabetes care management. The selection and application of a glucose lowering therapy are dependent on several considerations like the severity of hyperglycemia, hepatic and renal associated functions, risk of hypoglycemia, body mass index, ability to self-monitor the blood glucose level, and the cost of the medication. Okay, and first of the new trends is the stem cell technology, a novel therapeutic approach. These stem cells are unspecialized cells of the human body and can differentiate into any cell of an organism and have the ability to self renewal. It has been considered a promising strategy based on its immune modulatory and regenerative capability in the management of both type 1 and type 2 diabetes in combating the autoimmune response affecting their production and the receptor insensitivity, undermining their effect at the site of action. Next is the gene therapy and diabetes. This is designed to introduce the genetic material into the cells of patients to compensate faulty genes or deliver therapeutic transgenes. Dysregulating sugar levels is the most important aspect in the treatment. Somatic gene therapy involves the somatic cells of the body, includes two methods of gene delivery. The ex vivo gene therapy is described as the one in which the tissues are removed from the body. The therapeutic gene is inserted in vitro and then reimplanted back in the body. This therapy has been used to generate B cells for transplantation. The in vivo therapy involves the insertion of gene therapy vectors directly to the patients, which include genetic transfer of glucose lowering genes, which are non-insulin in nature, and application of blood sugar lowering genes. Okay, and the third one is the medical nutrition therapy. This is the nutrition therapy as a therapy for diabetes. Depends on certain factors such as patient's age-based nutritive requirements and food preferences, as well as other medical conditions, together with an exercise regime and recommended nutrition requirements depending upon the patient's ability and health conditions. The other one is the oral hypoglycemic incorporated nanocarrier-based treatment. This is a nanomedical device, which is a capsulate containing pores, which has been a promising tool in the drug delivery approach. Nanocarrier-based delivery systems have been proposed to overcome the enzymatic degradation in the stomach and thus to enhance permeation through the gastrointestinal tract, with the aim to improve oral insulin absorption. Next is the tissue engineering. This is a tissue engineering approach of culturing insulin-producing cells with extracellular matrix, or the ECM molecules in three-dimensional or 3D. Constructs has the potential to enhance the efficacy of cell-based therapies for diabetes. This, in addition of ECM molecules to the culture environment, depending on the specific type of molecule, can further enhance the viability and insulin secretion. Also, there's a natural products which has suggested the utilization of herbal medications for the treatment of insulin dependent and non-insulin dependent diabetes since time immemorial. Plants processing antibiotic properties may be suitable as an adjunct to the existing therapies or as a prospective source of new hypoglycemic compound. The next generation of diabetes treatments will focus on providing multi-faceted improvements of glycemic control for the patients. This includes tracking blood sugar in contact lenses, which is composed of a glucose sensor, a chip, and antenna embedded between two soft contact lenses. The device can provide minute-by-minute glucose readings, sending them to a mobile device. Another is the research are honing in on gut hormones known as incretins that travel to the pancreas, telling it to produce more insulin. And also in a new class of drugs that has recently emerged, black as sodium glucose co-transporter known as SGLT-2, which is responsible for the reabsorption of some 90% of the glucose filtered in the kidney per day. Diabetes care and management acronyms. Here are the ABCDEFGHIJ of living with diabetes. Follow these basic steps to protect your health. A is for A1C, which is monitor and control your blood sugar levels. B is for the blood pressure. Know your blood pressure and take steps to keep it in a healthy range. C is for cholesterol. Make sure your low density lipoprotein cholesterol levels are low. And D is for drugs to decrease your heart disease risk. This might include blood pressure pills, cholesterol lowering pills, and others. E is for exercise. Physical activity also helps control blood sugar levels and lower your risk of heart disease and nerve damage. F is for food or dietary control. If you have diabetes or pre-diabetes, your doctor will likely recommend that you see a dietitian to help you develop a healthy eating plan. G is for get self-management support. Set goals to reach and maintain a healthy lifestyle and understand what stands in your way. H is for healthcare use. See medical practitioner or have doctor appointments for diabetes treatments. And I is for insulin therapy. If diabetes is uncontrolled despite optimal oral glycemic therapy, you need to have the insulin therapy or medicine to control the diabetes. J is to just stop smoking. Nicotine increases your blood sugar levels and makes them harder to handle. The 21st century drugs to treat diabetes. In May 2020, the Food and Drug Administration, or the FDA trusted source, recommended that some makers of extended release metformin remove some of their tablets from the US market. This is because an unacceptable level of a probable carcinogen or cancer-causing agent found in some extended release metformin tablets. The oldest antibiotic drugs, metformin, has long been and will remain the first-line therapy for type 2 diabetes due to its low cost, physicians' familiarity with it, and the availability of long-term data. The medications for type 1 diabetes. Number 1 is the insulin. This is the most common type of medication used in type 1 diabetes treatment. There are more than 20 types sold in the United States. It's given as an infusion under the skin with the help of an injection pump or an injection. There is a lot of types of insulin, which is the first one is the short-acting insulin. Regular or short-acting insulin may reach the bloodstream 30 minutes after injection and peak 2 to 3 hours afterwards. These injections also works up to 3 to 6 hours. Types of regular insulins include, which is newly found or newly established, or the medication, which is the Novolin or Flexpen Relion. This is the one that will be injected into the fats and into the body. Next is the rapid-acting insulin. It works within 15 minutes, more faster than the short-acting insulin. The peak time is 1 to 2 hours after use, and the medication lasts between 2 and 4 hours. Types of rapid-acting insulin includes inhaled insulin, which is the brand name is Afrezza, insulin aspart, rely on Novolog Flexpen, or insulin glulicin, which is only available as a brand name drug. Next is another type of insulin, which is the intermediate acting insulin. This works about 2 to 4 hours after use, with an average peak time of 12 hours. You can expect this type of insulin to last between 12 and 18 hours. Examples include insulin isophane or Novolin and Flexpen Relion. And there's also a long-acting insulin. It helps lower your blood glucose levels for up to 24 hours or longer, and it reaches your bloodstream more gradually. The types of available long-acting insulin include insulin Detemir or Livimir, or the insulin Glargine YFGN, or the Semglee YFGN. Another kind of insulin, which is the combination premix insulins. And examples of this insulin is the insulin aspart protamine insulin aspart 70/30, or the insulin lesproprotamine or insulin lespo 75/25. There's also a amylinomimetic injectables. It works by delaying the time of your stomach takes to empty itself. It also reduces the secretion of the hormone glucagon after meals. These actions lower your blood sugar. And the example of this medication is the pramlintide or simlin-pen, is an amylinomimetic, which is used before meals. There's medications for type 2 diabetes, which is the insulin. Some people with type 2 diabetes may also need to take insulin. The same types of insulin used to treat type 1 diabetes can also treat type 2 diabetes. One of the examples of this is the biguanides. It decreases how much glucose your liver makes. They also decrease how much glucose your intestines absorb, help your muscles absorb glucose, and make your body more sensitive to insulin. Types of biguanides is the metformin, rosiglitazone or Abandamet, metformin, saxagliptin or Combiglides XR, and metformin, sitagliptin, Janomet XR. Another one is the dopamine 2 agonist. It's unknown exactly how this drug treats type 2 diabetes. It may affect rhythms in your body and prevent insulin resistance. Example of this is the bromocriptine or the cycloset parlodel, which is a dopamine 2 agonist. Also, the other one is the dipeptidyl peptidase 4 or DPP4 inhibitors, which are used to help reduce blood sugar without causing hypoglycemia. Example of DPP4 inhibitors include sitagliptin. Also, glucagon-like peptide 1 receptor agonist, GLP-1 receptor agonist, which are similar to incretin and may be prescribed in addition to a diet and exercise plan to help promote better glycemic control. These drugs include lixisenatide or adelexine, the semaglutide, Ozempic, and tirzepatide or Mounjaro. Mounjaro is the latest medication that was released last 2022. Also, the miglitinides. Miglitinides, it helps your body release insulin. However, they are not for everyone. In some cases, they may lower your blood sugar too much, especially if you have advanced kidney disease. These drugs include nateglinide or Starlex. The next is the sodium glucose transporter or SGLT2 inhibitors. This work by preventing the kidneys from holding on to glucose. Instead, your body gets rid of the glucose through your urine. Example of this sodium glucose transporter are the medication which is empagliflozin, linagliptin, metmorphin or Trijardi XR, empagliflozin, metformin, Synjardy XR, and the ertogliflozin or the Stiglatro. And other drugs are part of the sulfonylureas. These are among the oldest diabetes drugs still used today. They work by stimulating the pancreas with the help of beta cells. This causes your body to make more insulin. These drugs include glimepiride, pioglitazone or Duetact, glyporide, which is Glinase, and the glyporide metformin. And the last one is the thiazolidinediones, work by decreasing glucose in the liver. They also help your fat cells use insulin better by targeting insulin resistance. The options include the pioglitazone alogliptin or OCNE and pioglitazone glimepiride Deotact. And also this one is the latest. Last year was released. Last year, 2022, the pioglitazone metformin or Actoplas Met XR. And that's the end of my topic, and my colleague Charina will going to discuss or continue the topic about the use of herbal medicines to treat the diabetes mellitus. Thank you.
Okay, for the herbal medicines to treat diabetes mellitus is mainly used to treat through its anti-inflammatory, antioxidation, blood lipid regulation, and anti-glucose properties. It is superior in its holistic quality, which can treat type 2 diabetes mellitus through multiple targets and is as good complementary and alternative treatment for type 2 diabetes mellitus. Using traditional medicines, which is known for its availability and accessibility, compared to the high cost of conventional medicines. In addition, herbs and supplements are complementary treatment options and should not be replaced with medications. It provides health benefits beyond their nutritional value and is effective in the prevention and treatment of diabetes. Here are some of the following herbs and remedies that have been shown to have some efficacy in treating type 2 diabetes, which includes ginseng, fenugreek, psyllium, cinnamon, aloe vera, bitter melon, holy basil, and curcumin. As for type 1 diabetes, chromium, alpha lipoic acid, coenzyme Q10 was known for used to treat type 1 diabetes. So for technological advancements now that's being used to treat diabetes, we researchers have discovered new technology to use as monitoring and revolutionary enabling technologies to apply to healthcare as an opportunity to improve the lives of people with diabetes. So these advancements enable more meaningful monitoring of blood glucose values with the facilitation of more optimal insulin dosing and delivery. So there are dozens of research projects which being explored for different types of diabetes technologies and the benefits they can have for people with diabetes. This includes technology for taking insulin, for monitoring blood glucose, and for some diets that can be used through the application through our mobile phones. So insulin pump is technology which is good for taking insulin. It delivers insulin through a thin tube that goes under our skin. All people with type 1 diabetes and some people with type 2 diabetes will need some type of insulin injection option for the rest of their lives. So this pump can release small doses of insulin continuously, a bolus dose close to mealtime to control the rise in blood glucose after a meal. So this deliver mimics the body's normal release of insulin. So for technology, also for taking insulin, there's a hybrid closed loop systems, which is known also as a artificial pancreas. It is known as closed loop control, which is all-in-one diabetes management system that tracks blood glucose levels using a continuous glucose monitor and automatically delivers the hormone insulin when needed using an insulin pump. So this system replaces reliance on testing by finger prick, by testing finger prick or glucose testing with separately delivery of insulin by multiple daily injections or a pump. So there's also technology for checking blood sugars, which is good for people who are already dependent with insulin. So continuous glucose monitor and flash glucose monitor is used to monitor the or check your blood sugar levels without having to prick their fingers. So one of the benefits of a flash glucose monitor is being able to review what's your blood sugar levels, and you can do it every minute of the day and night. There's also technology to help us manage our diabetes like carb counting and ketone monitors. So these applications are already available in software through our mobile phones. So it helps us manage our weight, help us there's a application also for how to exercise and how to count our carbs. So these are not always only for people with diabetes. So we might find it helpful also for keeping a record of what we are eating and how much activity we do. These also applications that are designed for people with diabetes, covering everything to help us manage it. So there's application which is best for community conversations as per other topic that we have discussed is related to diabetes, which is related to depression. So this app is good for people which can relate with each other who has the same diagnosis. And we have application for best healthful eating, which is Foducate. There's one that is good for blood glucose tracking, which is One Touch Reveal. And there's one for best for monitoring glucose, which is Freestyle. And lastly, there's also a machine that can be used, which is the ketone monitors, which measures the amount of ketones in our blood. We know that high ketone levels in the blood can lead to a serious conditions called diabetic ketoacidosis. So monitoring our ketones are recommended for everyone with type 1 diabetes. So that's it for me in regards with the use of herbal medicines and the technological advancement which is now being used in our time.
Thank you, Ms. Charina. This is the end part of our presentation. Guys, if you have any questions, feel free to ask. And yes, so our speakers will be able to answer your questions. Anyone?
Yeah, I have a question.
Hi, sir. Yes, go ahead.
Can diabetes be treated with herbal medicine?
Okay, for the questions asked, can diabetes be treated with herbal medicine? While there are definitely benefits of herbal medicine for people with diabetes, herbal approaches can replace insulin. So main questions are asked if are you type 1 or type 2 diabetes, because some herbal medicines are not meant for type 2 and some are not meant for type 1. So initial appointment will determine what areas pose the highest risk and what approaches are likely to be most effective, creating a personalized treatment plan. Instead, supplements and herbs are meant to work synergistically with other aspects of a comprehensive treatment plan. They might be used to replace the deficient nutrients, help lower glucose levels, decrease insulin resistance, and reduce body inflammation or other diabetes side effect. So common focuses are vigilant control of blood sugar levels and attention to diet, exercise, and stress reduction. But definitely diabetes can't be cured, only managed. Thank you.
Okay, Ms. Mirel, go ahead.
Hi, I'm Meryl Panganoron from CSFF Medical Group, and I am a nurse. So my question is, can diabetes be fully controlled without medication?
Oh, thank you for that very interesting question. So, from the speakers, please.
Okay, thank you so much, Mariel, for your interesting question. And for your question, some people can control and manage type 2 diabetes without medicine, but many others will need diabetes medications along with lifestyle changes. If you are newly diagnosed with type 2 diabetes, your provider may first recommend that you manage your diabetes using lifestyle changes only. Controlling type 2 diabetes without medication means keeping track of your blood sugar, blood pressure, and cholesterol under the supervision of your diabetes care provider. You also need to follow a diabetes meal plan, get to and maintain a healthy weight, and make physical activity part of your daily routine. Keeping your A1C, blood pressure, and cholesterol in check may help you avoid the long-term complication of type 2 diabetes, which is what treatment is all about. So these complications include the heart disease, stroke, nerve damage, loss of vision, kidney failure, as what of one of our speaker discussed earlier. Thank you so much for your question.
Okay, thank you.
Anyone who has other questions?
Yes.
Yes. Go ahead. Mil Shadil.
What are the most recommended food for a patient with diabetes?
All right. Thank you for that question. Go ahead, Miss Shirjane.
For the question, what are the most recommended food for people with diabetes? So one is like for the starch, vegetables, fruits, protein, dairy products, fat, oil, and sweet, and even drinks. But for the starch, you need to be the best choice would be whole grain, such as brown rice and oatmeal, baked sweet potato, and item made with whole grain and no sugar added. And for the vegetables, fresh veggies eaten raw or lightly steamed, roasted or grilled, plain frozen vegetables, lightly steamed, greens such as spinach, and low sodium or unsalted canned vegetables. For the fruits, the best choice for that is the fresh fruits, plain frozen fruit, or fruit canned without added sugar, sugar-free or low sugar jam. And for protein, this is according to American Diabetes Association, plant-based protein such as beans, nuts, seeds, or tofu, fish, and seafood, chicken and other poultry, egg, and low-fat dairy. And as much as possible, try to include some plant-based protein from beans, nuts, or tofu, even if you are not vegetarian or vegan. You'll get nutrients and fiber that aren't in animal products. For the dairy, 100% skim milk, low-fat yogurt, low-fat cheese, low-fat or non-fat sour cream. For fat, oil, and sweets, natural source of vegetables, fats such as nuts, seeds, or avocados. Food that gives you omega-3 fatty acids such as salmon, tuna, or mackerel. Plant-based oils such as canola and olive oils. For the drinks, unflavored water or flavored sparkling water, unsweetened tea with or without a slice of lemon, light beer, small amount of wine or non-fruity mixed drinks, coffee, black or with added low-fat milk and sugar substitute. So that would be all for the recommended food for the people with diabetes. Thank you.
Hello, I'm Alex. I'm a nursing student from Philippines. This is my question. If my father has type 2 diabetes, does that mean I am more likely to get it also? Thank you.
Hi, Alex. Thank you for that wonderful question. If your father has type 2 diabetes, it is not inevitable that you will get it. What you hopefully have learned is that lifestyle and food management are so important to staying in good health. Stay active, eat and refined foods as much as possible, and manage stress levels. These are the first ingredients to a healthier life. Did I answer your question?
Yes. Yes, thank you so much.
All right, thank you. Is there any more questions? So if there's no more questions, then this is the end part of our presentation. So in behalf of the CSFF Medical Group, I would like to thank all the speakers for your excellent presentation and all the learnings that you have imparted. And of course, thank you to all our participants who are present today. Thank you for taking your time